Trying to encourage the government to understand pharmacy. What is the one thing that you would say to the government to help them support pharmacy and prevent any future funding cuts?
Oh, that's a tricky one, isn't it? I think, there's something about the relationships and the history that both the pharmacy organisations and the government have got to let go of, because we're in danger of getting to stalemate. This is kind of like the Brexit talks at the moment in terms of moving things forward. So I do think it's time now for people to have to put aside some of the differences that have happened in the past and the history and say, look, actually, this is about patient care. This is about having the best possible NHS that we can. How do we use all the skills and the attributes and the asset that community pharmacy has for the benefit of the NHS? And I think it's time, and this is a message not just to the government, this is a message to the pharmacy organisations as well.
Really to use our clinical skills, rather than distinguishing clinical pharmacists and community pharmacists are clinical pharmacists. They can be even better than they are. So invest time and money in training us to take away a little bit of the burden from the GPs, but then that will really help us to fulfill our potential. But we need that help from them, and rather than cutting our funding, help to at least maintain the funding, help to maintain funding for staffing, especially staffing, and training for us to fulfill our skills.
So I'd like pharmacy to be a lot more sort of intertwined with the medical profession, with the nursing profession, not only in the community but also in hospitals. What I've seen in my experience is that whilst there are a lot of efforts made by a lot of individuals and organisations for these healthcare professionals to work together, I think there's a lot more scope to be done within hospitals, for pharmacists to be truly well within the hospital teams, and in the community for pharmacists to work in GP practices, for pharmacists to work with the nurses and other healthcare professionals to provide a multidisciplinary experience for that patient to help them, again, to improve patient care. So I think what I'd like pharmacy to do and pharmacists to do as a profession is to make them known that they do have these skills, they do have this knowledge that can be used, that is taught to these students as pharmacists and healthcare professionals to help improve patient care and work and improve the NHS as well.
Government does need to know what pharmacists are all about. We're not just glorified shopkeepers. We're not just people that bag your medication and give it to you, put a sticker on it and give it to you. We're actually clinicians. We are very valuable members of the community. Okay, and it's just a message to the government would probably be to help promote that within the communities and to help people realise how important the pharmacists are. I think people also realise that, but I think the government needs to realise more that by chopping and changing and cutting and budgeting, they're gonna compromise on the services. Pharmacists are very valuable people in the community. Don't compromise with their skills and qualifications.
There is the social aspect as well, where the only contact a lot of the people have is with the members of staff, pharmacy staff, either face-to-face in the pharmacy or on the few that we deliver to. That's their only contact. We had a 92-year-old saying, have you got time to talk to me? You're the first person I've seen in 3 days.
Yes.
So, I think that these are the social pressures that we're unique in the sense that of the service that we provide.
Pharmacy is a science itself. At core, it's science, and numbers don't lie. When it comes to actions and outcomes, we save the healthcare economy plenty of money. We're accessible. Patients like coming and seeing pharmacists, right? And for a government that wants easier accessibility for patients, for them not to support pharmacy is the wrong message itself.
We are a lifeline in people's community. You would have more people in nursing homes, more people in hospital beds, you'd have people dying earlier, you'd have so many things going wrong if there wasn't a local community pharmacy.
I think my message and plea really would be that we have a £30 billion deficiency that could potentially be, busting the NHS by 2021. So we need to do things differently, and we need to do them fast. And my plea is that the national teams provide us with a mandate for local chief officers like myself and all the great work that other LPCs do, so that we have a seat at the table to engage with STPs, to engage with our commissioners, because at the moment it's like we don't have the equivalent of a GP forward view. We have the community pharmacy forward view, which is great, but maybe that hasn't been quite endorsed yet by the DOH or NHS England or our commissioners. But if we had that, then we can be more powerful in trying to actually integrate community pharmacy and into the care pathway, so that we can actually offer our contribution to medicines optimisation and support for long-term conditions and the prevention agenda, and also urgent and emergency care. That for me are the 4 pinnacle areas where we can support.
Yeah, pharmacy is underestimated, and we can put a lot to save the NHS.
Absolutely, and I think that there isn't a lot of choice out there. Where else are you going to go? I mean, there's a limit to the number of urgent care hubs that you're going to open. That you're not going to find an 11,000 network of any healthcare professional anywhere else. I think it's calculated at 1.5 million visits a day. I don't think there's any other healthcare professional that has that level of contact with their patients. And we want to be able to help. We want to be able to support the NHS. We want it to flourish. So allow us to help you. Tell us what you want.
They need to set us on the table and engage, not as an isolation amongst us. Sit with us as a team, right from the beginning. Don't say, maybe pharmacists can do that. Always a big problem. In clinical pathways, service design, everything's wrong. So there's no duplication of service. We work in harmony with each other. Where do you create synergies rather than looking at you're working on your own? It's where you're creating this competition amongst each other. But how can we work together? Sit us on the table together, right from the beginning.
And we all want the same outcome, is the health and well-being of the patient.
Start with the patient in mind, and then work around what else can we work in there. If you work on that, the patient will benefit, so will everybody around you.
Because if we're offering patient-centered care, we need to have integrated health care where everyone contributes their quota. I mean, the community pharmacist is very important in the community. The role they provide is very, very important.
We're already producing outcomes, with flu vaccinations and with other services. It's about how much the NHS money can be saved by pharmacy, and I believe we're doing that already.
Look at your budgets and see where the big savings can be made, and it's not done by cutting pharmacy's budget. They are saving you millions daily.
Speak to pharmacists. Come and speak to us. Speak to pharmacists, speak to patients, speak how much impact pharmacists can make, even GP practices and GPs. Because I feel they are making decisions without our input and understanding. So until they speak to us, I don't think.
So really, we want the government to see reality, to speak to pharmacists, to healthcare professionals, to GPs, and to patients especially, because the impact is on patients.
Absolutely.